I'm Nirav Shah, the director of the Maine CDC. I'm joined this afternoon by Commissioner Jean Wambrew from Maine's Department of Health and Human Services. Commissioner Wambrew and I are pleased to be with you today to give you an update and talk about where we stand with respect to COVID-19 for the state of Maine for today, Wednesday, October 27th, 2021. We begin today's update on a sad note. The Maine CDC is reporting 7 additional COVID-related deaths today. One of those individuals was a resident of Cumberland County, another a resident of Kennebec County, 3 who were residents of Penobscot County, 2 who were residents of Somerset County. 3 of these individuals were women and 4 were men. 3 were in their 50s, 1 was in their 60s, another in their 70s, and 2 in their 80s. Commissioner Wambrew and I would like to offer our deepest condolences to the friends, family members, and communities of these individuals who have passed away. Right now, across the state, there are a total of 102,469 cases of COVID-19, representing an increase of 620 cases. Cumulatively, since the beginning of the pandemic, 2,759 people have been hospitalized with COVID. And right now in Maine, 209 people are in the hospital with COVID-19. To put that number in context, 2 weeks ago, 1 incubation period ago, there were 168 people in Maine hospitals with COVID-19. That's a 24% increase in hospitalizations over 1 incubation period. Right now, of those 209 people, 74 are in a critical care unit. 2 weeks ago, there were 60 people in the ICU. And right now in Maine, 34 people are on a ventilator. 2 weeks ago, 29 people were on the ventilators. Statewide, as of this morning, there are 46 ICU beds that are available. Turning next to testing. The 7-day PCR positivity rate in Maine right now stands at 5.45%. Again, for comparison, 2 weeks ago, that number stood at 5.2%. In terms of PCR testing volume, right now in Maine, that volume stands at 500 PCR tests that are being conducted for every 100,000 people in the state. 2 weeks ago, we were conducting only 415 PCR tests, representing a 20% increase in PCR testing just over 1 incubation period. What I really want to talk about today is where we stand with vaccines and the vaccination effort. Let's start with some population level numbers. As of today, 76.1% of every single person in Maine has received at least 1 dose of COVID-19 vaccine. And 70.2% of the entire state is fully vaccinated at this point. On the ground right now, Maine is administering 5,200 doses of COVID-19 vaccine every single day. That's a significant increase. It's a 30% increase in our daily vaccination rate over the past 2 weeks, and a 33% increase just over the past 7 days. Let's break that down by first, second, and booster doses. First doses in Maine have increased 25% over the past 2 weeks, from about 588 to 738. Second doses, or single doses of the J&J vaccine, have really significantly increased. They've gone up by 120% just over the past 2 weeks, from around 1,180 doses 2 weeks ago to about 2,600 doses today. Boosters, by contrast, have actually come down a bit. They've decreased by 14% over the past 2 weeks, from around 2,130 to about 1,850. Right now in the state, about 35% of all vaccines administered on a daily basis are boosters, which of course means that about 65% of all the vaccines administered day on day are primary series shots. That's good. Just a few weeks ago, about 50% of the shots we were doing every day were boosters. Now, here's what I mean. The boosters are important, no question about it. Notwithstanding that, primary series shots remain our focus. The relative increase of 25% for first doses and more than doubling of second or single doses of J&J over the past 2 weeks is undoubtedly a good thing. It's something that we want to keep up. Next, I'd like to take a minute to break down who is getting vaccinated in the state, and particularly where they are getting vaccinated or where they are from. For this section, I'm going to just focus on the last 7 days. Let's start with the age groups of who is getting vaccinated and where we are seeing the biggest changes or shifts. What we've seen in the past week is that people in their teens, 20s, 30s, and 40s are getting vaccinated at high rates, particularly in rural counties. Again, a good sign. Let's focus on those who are in their teens and 20s. For that group, the counties of the highest growth as a percentage of their population in that age category, the counties of the highest growth over the last week have been Piscataquis, Washington, Somerset, Aroostook, and Saginaw counties. That's for people in their teens and 20s. Let's zero in now on people in their 30s and 40s. For that age category, the highest growth over the past week is again in rural counties. Piscataquis, Penobscot, and Washington in particular are where we have seen the highest growth. That is again a good sign. And what it means that in the past week, people in their teens through their 40s in rural counties in Maine have been getting vaccinated. That's a good thing for them as well as for the entire state. Let's now take a look at the age groups where there has been the most growth over the past 7 days. And the bottom line here is that we've seen the largest increase in those individuals aged 50 and over who have been getting their shots in the past week. In that time period, in the age category 50 plus, that group has increased vaccination by 4.4% across the entire state. Whereas for people in their teens, 20s, 30s, and 40s, that rate has gone up from 1 to 1.5%. It's great to see more and more people getting vaccinated all across the state. So what does all of this mean? The bottom line is that it means that Maine's vaccination infrastructure is robust and ready to go, particularly as we plan and prepare for the coming childhood COVID-19 vaccine effort, which is the last thing I want to talk about today. Here is what you need to know as we plan and prepare for childhood vaccinations. Yesterday, an advisory committee to the US FDA met and discussed the data around the safety and effectiveness of Pfizer's COVID-19 vaccine for children aged 5 through 11. This does not mean the vaccine is authorized yet, even though that committee voted to recommend to the FDA commissioner that she issue an emergency use authorization. That recommendation on its own does not yet mean the vaccine is available. The next step in the process, or the next steps in the process, are first for the US CDC's own advisory committee to meet next week and provide clinical recommendations to the US CDC director. That meeting is happening next Tuesday and Wednesday. If the US CDC director accepts those recommendations and the US FDA's acting commissioner issues an emergency use authorization, then and only then might the vaccine be ready to roll. Now, here's what we know about the Pfizer vaccine in kids. The data that were presented yesterday showed that the vaccine is 90.7% effective at preventing symptomatic COVID-19 disease. The data also showed that when children did indeed get COVID, even though they had been vaccinated, their symptoms were milder. This is encouraging and good news for the parents of the approximately 79,000 kids in Maine who are between the ages of 5 and 11. As the president of the U.S. American Academy of Pediatrics put it, the COVID-19 vaccine offers a tangible opportunity for children to return to a more normal daily life. Here in Maine, we are working with providers and places of all types, whether that's doctors' offices, pharmacies, community clinics, and schools, to make that vaccine, that tangible opportunity, happen equitably, quickly, and widely across the state. So with that, Commissioner Lambrew and I are happy to take any questions. And the first question for the afternoon goes to Corey Bouchard from WAGM.
Thank you, Dr. Shah and Commissioner Lambrew, for taking these questions. My first question is about the outbreak at the Aroostook County Jail. I was wondering if you had any update about the conditions, and yeah.
Sure, thanks, Corey. Here's what we have in terms of the numbers right now. As of this morning, we were aware of a total of 72 cases associated with the Aroostook County Jail, 12 cases among staff members, and 60 cases among residents. Maine CDC has been working very closely with the Maine Department of Corrections, as well as with the leadership of the Aroostook County Jail. Maine CDC's portion of this is focused on things like arranging for testing, which some of our public health nurses were on the ground doing. We're also making sure that staff members and residents at the jail, for example, have access to the PPE we need. We also have an epidemiologist at Maine CDC who is dedicated toward outbreaks in facilities of this sort. That individual has been working with the jail to provide guidance on infection control and ways to tamp down the outbreak and prevent further transmission.
Thank you. And my second question is, are there any other outbreaks currently within Aroostook County?
I will check just to make sure. I don't want to speak out of turn. Corey, we'll double check and get back to you if there are. There may, in fact, be some associated with schools or long-term care facilities. So we'll check and make sure we get you any other potential outbreaks that are ongoing, any outbreak investigations that are ongoing there.
Thank you.
Thank you. Let me go to Eric Russell next.
Thank you, Dr. Shah and Commissioner Lambrew. One of the questions I had is, we're 2 days out from the state's enforcement of the vaccine mandate for healthcare workers. From a practical standpoint, how is that going to work? Is DHHS going to audit medical providers to make sure that they're complying? Is it going to be the honor system? And then, what's the penalty if they're not complying?
So we are building our enforcement or compliance activity around the COVID-19 vaccine requirement on top of what we already do, which is there's long-standing rules that do require a battery of different types of immunizations for healthcare workers. And what that means in practicality is that at the end of this month, we'll do our final monthly survey of our healthcare facilities to see where we are with their vaccination rates. We will use that information to begin working with those facilities to find out what's going on. Do they need support? Are there problems? We will then in December convert that monthly survey into an annual compliance report, which will serve as the basis for how facilities will report their compliance with the rule. In addition, we will also deploy typical compliance tools such as random audits and complaint-driven investigations to protect the healthcare workers as well as their patients and residents.
Okay. The other question I had, and this might be for Commissioner Lambrew as well, we've heard a lot from nonprofit agencies that run group homes for adults with intellectual disabilities. And, they're saying there's a real crisis situation that's going to be looming here. Worker shortages already exist. The vaccine mandate is going to result in more. The real risk of vulnerable people losing their group home placements without any alternative. And I just wonder, is there anything more the state is going to do or can do to help, prevent these group homes from closing?
Yeah, we always are looking for new creative ways to support some of these group homes, because as everybody knows, number one, the healthcare workforce shortage is not new in Maine. Both our demographics with an aging population, which means more retirements of workers, as well as an aging population that puts more demand on our health and long-term care system, has been around. So this pandemic has just exacerbated it, and we appreciate that. So in addition to, number one, working on financial support so they can do those recruitment and retention benefits, we've been working on that across the healthcare spectrum, including group homes. That's on the horizon. We've also been trying to provide flexibility. So, for example, allowing them to bring in workers who are in training, not yet certified, for a time period so they can be working on the job as they're finalizing their certification. We look at how we can help them connect with pockets of people looking for jobs through our Maine Department of Labor Career Centers and JobLink. We also have been working on how to keep workers. How do we make sure that those workers know about childcare options, housing options? So we're taking an all of the above approach to trying to help our healthcare facilities, group homes, long-term care settings stay staffed and keep people safe.
One quick one for Dr. Shah, if I may. You mentioned the groups that are starting to get vaccinated at a higher rate, these younger groups, teens, and then 20s, 30s, and 40s. Do you have any sense of whether you're seeing patterns of why they are, why now, in the sense of, are they expecting that they're going to be subjected to a vaccine mandate, or maybe they already are subject to it?
Eric, that's a great question. My team and I were discussing that exact question this morning. Up front, I don't have the answer. We all have our relative hypotheses. One hypothesis that some folks and a counterpart of mine in another state has offered is that the picture on Delta has really become sharper, and things like hospitalizations and deaths are starting to get folks off the fence. Others have suggested that it, as you noted, may be potentially related to mandates, current or future. I'm not sure, to be totally candid with you.
Okay.
We're pleased to see it, and that's what I wanted to really report on today. It's good. It's definitely good news, but the why piece, we're gonna be digging into it more.
Okay, thank you.
Yep. Patrick Whittle, over to you.
Thank you very much. I wanted to start with a number question, just to make sure I understand one facet of what we're talking about. You mentioned that over the course of the past week, the rate of daily vaccinations is up. I believe the number was 33%. That means the number of shots that are given on a given day, right? Is what that means?
You are correct, Patrick. That is shots given per day, be it first, second, or booster doses. It's just aggregate number of shots per day. And you're right, just over today compared to 7 days ago, that number is up 33% to now about 5,200. I will get you the exact number just to make sure you've got that. Let me just find it in my notes here. The exact number is 5,206.
Okay. Got it. And 35% of those are boosters. With boosters coming online relatively recently, are you surprised they don't make up a bigger percentage?
I'm not, Patrick. We saw that earlier when boosters had first been announced, authorized, rolled out, that they were comprising a pretty big part of the pie. At one point, almost 60%, and I believe that was about the peak. Since then, it's tapered off. That's been driven by two things. A lot of the folks who were avidly looking for a booster got their booster. Right now, that's about 79,000 people in Maine. And then offsetting that is the growth, or not offsetting it. Also part of that is the relative growth in first and second doses. So there's both of these things at play. It's not simply that boosters have slowed. It's both that boosters have slowed and first and second doses have increased. That doesn't surprise me. I'm glad to see boosters are still out there, but I'm more glad to see that primary shots are picking up.
Got it. You also mentioned that in some of the rural counties that have lag behind some of the more urbanized parts of Maine. There seems to be a bit of an increase there as well. Could you speak to why that might be and what the state needs to do to make sure that keeps happening? Because some of the more rural counties like Piscataquis and Somerset are still below 2/3.
You're right. I mean, it's a good trend. It's an encouraging trend. I'm hoping it continues. There's no question about that. Your first question is why? Kind of similar to Eric. We've all got our hypotheses. I'm not sure what's driving this particular increase. We're trying to do what we can to sustain it. Particularly there, Patrick, we're focusing on access. We're making sure that places in rural counties where folks go for healthcare and public health services are stocked and ready to give the vaccine on the day that someone decides they want it. Whether that's a pharmacy, a doctor's office, an area hospital, we're making sure they've got everything they need. We're hoping that planning and preparation then rolls over to the pediatric processes as well, essentially making sure that the machinery is well oiled and running so that when the pediatric vaccine comes out, it's ready to go. I hesitate to speculate as to why we're seeing this increase, but we want to keep it sustained and going.
Got it. Thank you very much.
Yep. Thanks, Patrick. Chris Costa, over to you next.
Hi, Dr. Shah and Commissioner Lambrew. I won't ask you any more why questions, even though I have lots of them. But I will ask you about the kind of trend we're seeing in terms of the hospitalizations and deaths. It seems as if it's kind of, in the past, in the course of this pandemic, we've seen spikes, times where hospitalizations and deaths were high for a relatively short period of time. But one of my coworkers has been taking a look at the data and noticing that it seems to be more sustained, that the hospitalizations are staying high for a while, as well as the deaths seem to be a higher number every day, higher than they were in the past. Any idea why we're seeing this being sustained for this period of time and not a spike like in previous surges?
Chris, I have some ideas, and I want to caveat them as simply being ideas based on some trends that we've seen in the data, and that I've compared notes with counterparts and across the country and some other epidemiologists. Let me characterize it this way, and again, caveat that this is a hypothesis that we are investigating more. But the trend that we're seeing in Maine right now, with, as you noted, sustained high rates of hospitalizations, sadly, deaths and cases, we are not alone. We're seeing it also in Vermont and New Hampshire. And what differentiates northern New England from other parts of the country from an epidemiological perspective is that up until recently in the pandemic, rural parts of these three states were relatively protected from COVID for a number of reasons. But with the more virulent, more transmissible Delta variant, those parts of the state, be it Vermont, rural Maine, rural New Hampshire, the virus is being introduced into those parts of the state in places, in pockets where there had previously been virtually no exposure to COVID. In comparison to other parts of the country where even in rural areas, the rural southeast, the rural south, the virus had made its way through there, leaving people with varying degrees of immunity previously based on when the waves came through. Up here in northern New England, the Delta variant, when it arrived here and started moving into rural areas, essentially came upon a population of individuals with no prior exposure and thus virtually no prior immunity. This is borne out by some recent data from the CDC and the NIH, which look at various blood samples that are submitted to try to get a baseline sense of the number of people who have had previous disease. And when you look at Maine and Vermont in particular, what you see is 1 to 2% of people having had prior disease compared to 20 or 30% in other states. So in short, Chris, what that suggests is one reason we're seeing high numbers and spikes right now is that we are essentially experiencing what much of the rest of the country experienced in 2020, which is to say the virus making its way through unvaccinated populations. That's a hypothesis. It's one that I've chatted with other epidemiologists as well as epidemiologists here about. We're looking to see if we can shore that up, that theory up even more.
Got it. And then my second question, I know that in previous briefings, there's been a lot of discussion about how the pediatric rollout for vaccines would work. We've talked a lot about the school-based clinics being a major option. And I guess my question has to do with sort of a combination of, as more people become eligible for their boosters or third shots, as well as the potential emergency use authorization for the pediatric shots, does the state anticipate either one of two things: needing to reopen some of the mass vaccination sites or reaching out to the federal government for help, like with a mobile vaccination unit?
Sure. Thanks for that question. Thank you for that question, Chris. What we've done in terms of our planning is assess not only what's being done right now, the 5,200 shots per day, but also how much headroom we have in the system. How many more vaccines could we be doing as a state if or when the demand and the need were there? And when we compare where we are now versus A, the number of vaccinators out there, and B, what we were doing previously, we see that we've got a lot of headroom in the system. What that means, Chris, is that in answer to both of your questions, at this time, we're not planning on reopening any more of the large scale sites. For example, 2 of them are still open: the Auburn Mall and the site in Sanford operated by York County EMA. Both of those are open and will remain open. So really the question, Chris, is will we open any further ones? Not at this time. That's partly because there are sufficient providers who are on the ground, doctors' offices, pharmacies, et cetera, who are there and able to deliver a vaccine, both in their offices and in the school-based setting. That could change. And if that changes, if we see demand that we need to meet through vaccination efforts, Commissioner Lambert and I won't hesitate to call in whatever resources we need to. But at this time, our analysis suggests that we've got sufficient headroom in the system.
Okay. And I promised I wouldn't ask a why question, but I hate to leave a stone unturned. You talked about the first shots that have increased, the primary series of shots that have increased so much. That's been the state's goal, at least for a couple of weeks now, since we talked about boosters coming online and the necessity for first shots to make sure more people get vaccinated. And I hate to use the word why, but do you have any idea as to why we saw that increase, or how did it happen? Did the state do anything intentionally?
Commissioner Lambert?
I mean, you can just tell me no.
Job of saying we're not sure before, but
okay,
I will say, I'll make one observation though that I think is important. It does prove there's hope. You know, we oftentimes got the question about why are our numbers not ticking up? Are people dead set in their opinions about the vaccine? Are we done? Are we hitting a plateau? Is this it? And I think that the recent data do prove that people do learn, they do listen, they can change their minds, which I think is very encouraging. So we will continue to try to get more fidelity around the answer to the question why, but I do think it gives us all hope that we really can continue our effort to make Maine people safe through the vaccination.
Thank you for the patience and for humoring me. Appreciate it.
Thanks, Chris. Patty White, over to you.
Thanks very much. Just following up on Chris's question about what's different between Northern New England and other places. I mean, does our older population, does that play into it at all also?
It does, Patty, but I think in the following manner, which is early on with vaccines and vaccination, there was a hope that the vaccines would decouple, that was the term that was used, cases from deaths. What we've seen recently in Maine and in a number of other states and in countries, the UK, for example, is that hasn't really happened in the manner that we hoped it would. In Maine, I think what has happened is two things. The first is, in light of our older than average population, those who have been fully vaccinated, even though they've been fully vaccinated, may have other chronic medical conditions that mean that if or when they get COVID and experience a breakthrough case, their likelihood of passing away is a bit higher. And that's one thing that's going on. The other is that we've continued to see individuals who are unvaccinated and elderly be among those who are passing away. So the age piece does play in both of those facets.
Okay, thanks. And then I've got a question about booster shots. Are you tracking booster shots for nursing home residents? Do you know what the uptake is?
We are tracking it. I don't have those numbers for you, Patty. We've been working very closely with nursing homes and their associations to make sure that residents of not just nursing homes, but group homes, congregate living facilities of all stripes have access to boosters, and we've been tracking it in partnership with them. I don't have those numbers right now, Patty, but I will see what I can do to find them.
Okay, thank you.
Mm-hmm. Let me go to Amy Brown next.
Thank you, Dr. Shah and Commissioner Lambrou. First, I have a question from a listener who notes that the state of Vermont has chosen to provide boosters to anyone 18 or older. And they ask, they say, would Maine consider something like that? Because although people that in younger age groups tend to have much lower rates of hospitalization themselves, they can obviously still spread it to others. And they also ask if there's any evidence that people who are younger are not having the same decline in effectiveness of the original vaccines over time that's being seen in older folks.
Sure. Well, Amy, I think the place to start that is by noting first just how expansive the US CDC's recommendations on boosters are. Not only do they encompass everyone 65, they encompass folks who have a high number, any one of several medical conditions that could predispose them to worse outcomes from COVID, as well as folks who live in or work in an environment that is higher risk for COVID transmission or acquisition. It's a pretty high group, a high number of people. For example, one of the medical conditions that is on the list is obesity or being overweight, having hypertension. When you combine all of those, what you start to see is that there's a lot of folks that are eligible for boosters, just with the recommendations as they are right now. Now, to your particular point of whether we may expand those as a state, generally speaking, we've relied upon the expert analysis from the US CDC and their team in basing our recommendations. Generally speaking, states are to follow those recommendations as well. So at this time, we don't have any plans to deviate from the US CDC's recommendations. Amy? All right, we'll come back to Amy in a second to see if she has any follow-ups. Meanwhile, we'll go to Megan next.
Hi, Dr. Shah. This is probably a quick question, but for those people who have been vaccinated but also have had COVID, is there a recommendation for a booster on top of that as well?
Great question, Megan. The answer is yes. So an individual who had COVID, got vaccinated, they should still get a booster as per the normal schedule that's set forth. So 6 months if they got the Pfizer or Moderna shots, 2 months if they got the J&J shot.
Okay. And then my second question is really the definition of putting the cart before the horse. But I think a lot of people now, with the advisory committee recommending the vaccine for ages 5 to 11 now, of course, there are more steps to come. But I think a lot of parents are thinking, does this mean my kid, once they have a series and are fully vaccinated, will they be able to go maskless? Oh. And I think obviously that's a long ways off, but is it a long ways off?
Well, Megan, I appreciate your acknowledgement of the cart and the horse in this. It's too early to say, and there's a diversity of opinion right now. The US CDC director herself has indicated that even after vaccination is widespread, there may be a period where masks still stay on, particularly in school settings, because recognize that every child may not be vaccinated at all or on the same schedule. Separately, my counterparts and colleagues and I have had conversations about what does the second half of the school year look like, and particularly with the arrival of the vaccine for 5 to 11. Certainly that's the direction we're hoping to go, Megan, but it is too early to tell what that looks like, or let me ask it or frame it differently. The discussion right now is around what metrics we would need to see in order to know that we have arrived there.
And do you know like what those metrics are?
Some of them are fair. Some of them are the ones that we've looked at and talked about in general with masking. For example, the case rates and the US CDC's counties of designation, substantial, high, et cetera. Some of them may be a little bit more granular. For example, maybe we look at vaccination rates within schools. I've actually asked the US CDC to come up with a metric or a system or a scheme that helps us understand this and apply it at the county, state, local level, because I think it should be something that we think about as a country, but then apply at the local level on the ground. So I've asked them to think that through and help states come up with a system that is useful. Right now, no final answers on that yet, Megan.
Okay, thank you both.
Mm-hmm. Amy, let me turn back to you. All right, we'll check in with Amy one more time while we go over to Evan.
Hi, Dr. Shah, thank you. You mentioned that there had been an increase in the PCR test volume, and I was wondering with the Canadian border opening in November, are there any plans to further increase the availability of COVID tests and the speed of the results, which, as we've talked about, can sometimes take some time to come back, especially when there's a spike in cases?
Yep. Yes, the bottom line there, Evan, is yes, we are working particularly in border towns, or one border town in particular, to make testing more available. Don't have anything to announce yet, but it is something that we are really working on. Now, one note there, Evan, just for awareness, I think you're on this, but the testing predominantly applies right now to American citizens who would need to go across the border. As I understand the documents that have been put out, Canadians who would be coming in would need to be fully vaccinated. So it's really an effort to make it such that those on this side of the border who want to visit their friends, family, or go to Canada for work can have more easy access to testing. That access is already there because that side of the border, the US to Canada side, has already been open. And so we've already been working with pharmacies and other locations that are on those border towns to make that testing available. Could we do more of it? Certainly, because we think that there will be more of that cross-border activity. But right now, that's already in place and it has been working.
Great, thank you. And just a quick follow-up. I'm wondering kind of in those border town areas in northern Maine, if there are still kind of those delays in the results of tests coming back that are maybe presenting some challenges for people who want to travel.
Evan, we're going to check. I did hear about some of those concerns, and Commissioner, if you've got other data, please. I did hear about some of those concerns, particularly down east, several weeks ago. I'm going to check, Evan, to see if they are still if they're still ongoing. Some of the areas that were conducting testing down east, in particular, were commercial pharmacies that were often sending those swabs to a central laboratory, not here in Maine, but to a big hub somewhere. And that may have been introducing some concern and delay. That was several weeks ago. We'll check with the team and see if those concerns are ongoing, though.
Okay, thank you.
Yep. Thanks, Evan. Brian Sullivan, over to you.
Thanks, Dr. Shah. As you both sit here today, I know the vaccine mandate is coming up on Friday. And it sounds like from what Commissioner Lambert was saying, you'll have a little more information once you get into November and December. But where do you anticipate, what facet of the healthcare worker industry do you anticipate needing the most assistance or having the most loss of boots on the ground based on the mandate that is coming?
Sure. And I will just remind folks what Maine Health said quite clearly yesterday. They anticipate that the workforce problems that they're facing will be lessened by more workers being vaccinated because they've had so many workers who've had to go out for isolation or quarantine during this pandemic. That virus effect has been greater than the vaccination requirement effect on workforces. We continue to hear that. We do, looking at the larger landscape, know that we have We continue to work on nurses because we know that, again, we've always had a nursing shortage, and we have an especially big one now with traveling nurses being able to get reimbursed at very high rates. So people are changing their employment model. And so we're looking at nurses. We are looking at our kind of direct personnel, direct care personnel, because they're often the people for whom they could substitute a job in different parts of Maine economy for their job and earn equal pay. So we just continue to look at each of these pockets of workforce and try to see what is the solution. And again, sometimes it's one by one with organizations to kind of figure out, is there some way we can work with the structure of one organization's staff to make it work better for their residents? Sometimes it's broad-based. We get one suggestion from an organization that would work better for everybody. We do now have on the DHHS homepage a recruitment and retention toolkit that we try to put up all that information that facilities might not otherwise know about in terms of what we are able to do to help with this workforce challenge, which again predated the pandemic, has been made worse by the pandemic, but we stand ready to address it in the short run as well as work on long run solutions. On Monday, Governor Mills announced our $14 million investment in loan forgiveness, on the job training programs, other means to make sure that when we're coming out the other side of the pandemic, we have a robust pipeline of workers coming into the healthcare field.
Thank you. And something a little different, just Halloween is Sunday. If you wanted to give us the playbook for a safe and happy Thanksgiving, Halloween. If you want to get to Thanksgiving, you can jump ahead. And also, medical opinion, Dr. Shah, better off to eat a little bit of candy a couple days in a row or a lot of candy all at once?
Oh, okay. Well, there you go, Brian. We'll get to that one in a minute. So here's the bottom line with Halloween. And the U.S. CDC, to their credit, has put out a really nice piece on ways that you and your family and your kids can stay safe and still enjoy a good Halloween. It's just crazy because a year ago we were talking about this, and here we are 1 year later. The bottom line for Halloween is that Halloween generally is an outdoor activity, something that can be done safely. The same things that you would do with your family to keep them safe with any other outdoor activity are the ones that you should be looking at for this Sunday. Keeping things outside, of course. You're going to be with a large group, trying to stay spaced out. When you're going to someone's house, don't get all up in their face. Try to keep some distance. And then, of course, if you're going to be indoors, if you're going to be celebrating at a Halloween party where there's a lot of folks indoors and you're not sure what the best thing to do there is, you need to wear a mask. That's a way to keep other people safe. It's a way to keep yourself safe. Halloween can happen. It should happen. But there are also ways, as with so many other things that we're learning to do with COVID now, it's not about whether to do it. It's about how to do it in a manner to stay safe. Brian, in terms of candy consumption, one more note there on safety tips. Our various social media channels, Maine CDC, Maine DHHS, we're going to be sharing tips and graphics on ways to keep Halloween safe this year. So please keep an eye out on those. In terms of candy consumption, my overall general approach to candy is, essentially smoke if you got it. So here, I think the more amount of candy that you can consume within reason is the right way to go. So Halloween should be a good time this year.
Thank you.
Yep. Let me go over to David Marino from the VDN next.
Thanks, Dr. Shah and Commissioner Lambert. Do you see reluctance from parents to vaccinating their 5 to 11-year-olds as being a major problem? And how would you approach addressing their resistance?
I'll start, but again, Commissioner Lambert and I have discussed this on numerous occasions. David, I'll start with thinking about the vaccination effort in children, similar to the data that's first started coming out about a year ago when it came to vaccination in adults. And about a year ago, what we saw was that about 30% of adults said that they definitely wanted the vaccine, 30% said they were unsure, and about 40% said absolutely not. But as Commissioner Lambert noted just earlier, those numbers have changed now such that 70% of every single person in Maine has been fully vaccinated. Fast forward to today, Well, we're seeing the same thing with respect to parents getting their own kids vaccinated. 30% saying absolutely, 30% saying maybe, maybe not, 40%, this is nationally, saying absolutely not. But what the difference there, what changed that first set from 30% to 70% are the same tools and approaches that we're going to use with parents of kids 5 to 11. Answering their questions earnestly, talking about the data, making the case for why the vaccine is safe and effective. Will there be concern among parents? Of course there will be. Totally reasonable. Our job is to be straight with people, answer their questions earnestly, and make sure that they've got the tools and the data they need to make sure their kids get the shot, pretty much.
And I'll only add that we also are going to closely monitor what happens in the first few weeks once it is authorized to see if there are any gaps. And that might include trying to do special clinics with trusted organizations like churches or community groups where the parents can come with their children and be able to ask questions and give consent on the spot. So we're going to be just monitoring, seeing if there's other ways that we could get to those parents in ways that would give them the information that they need to make these decisions.
Great, thank you both. And my second question was, how do the efforts to vaccinate 12 to 17-year-olds in the past several months inform officials in this new stage? Are there any lessons from those previous efforts?
Absolutely, David. Two lessons. One being the positive, which was utilizing a school-based approach, which is what was used for the adolescent 12 to 17 population. Was successful. Parents found it to be useful. We also found that particularly parents for whom accessing the healthcare system was a challenge, parents who don't have a pediatrician or don't have regular access to a family physician, found the school-based approach that we use with 12 to 17-year-olds to be something quite useful. So that's going to be a mainstay of our approach here. The other, to pick up on what Commissioner Lambrew noted, is making sure we're meeting people where they are and answering the questions that they've got. So we're going to be focused on both of those things. We learned a lot throughout the vaccination effort thus far, particularly with kids 12 to 17, and we're going to be building on that going forward.
Great, thank you both.
Great, thanks, David. Amy Brown, let me just give you back to you if you happen to be back on.
Hi, thank you. I'm sorry about that. I lost internet for just a second, and I'll listen back for your answer to my previous question. But the other question I had was, we have heard from some folks in southern Maine who are eligible for boosters that they've had to wait a few weeks to get an appointment for a vaccine from one of the major healthcare systems. I'm just wondering if there are any issues with supply in the state, or if you still have plenty of vaccine available of all of the different types for anyone who is eligible.
Thanks, Amy. The answer to your question is there are no supply concerns with any of the vaccines right now in Maine, whether it's the Pfizer booster, the Moderna half-dose booster, or a second shot of J&J. We have ample supplies of all of those vaccines in Maine. For folks in the southern Maine area in particular, who are looking for a place to get a booster, I know for certain that the York County EMA site that's in Sanford at the old Marshall's building is open several nights per week and almost all day on Saturday, I think 8 a.m. to 4 p.m. on Saturday. And they are offering boosters of all sorts, Moderna, Pfizer, and J&J. I've been in regular contact with the director of York County's EMA, Director Cleaves, and I know they are open. No appointment is necessary, and their hours are particularly suitable for folks to go after work.
Great, thank you.
Thanks, Amy. And thank all of you for taking some time out of your afternoon to join in. Thanks to my colleagues in the media. Commissioner Lambrew, anything from you before we close out?
I'll just add on the topic of boosters that the federal government this last week issued guidance reminding all of our different insurance companies, Medicare, Medicaid, that the boosters are free. If an individual needs a booster shot, there's no charge to you. That's why, again, when you are calling your doctor or going to a pharmacy, just say that you want the booster shot. If you get other healthcare, there may be a cost to that, but we just want everybody to know that we've all worked very hard to make sure that COVID-19 vaccines are accessible to people without the financial barrier.
Great. Thanks, Commissioner. And thanks everyone for taking some time out of your afternoon. Very much appreciate it. We look forward to chatting with everyone again soon. In the meantime, as always, please be kind and take care of one another. We will talk again soon.